Today, I'm going to talk to you about something that affects each and every single one of us, regardless of race, religion, gender, or sexuality, because it is part of the universal human experience. It's going to affect each and every one of us all the time, because sex is everywhere in our society. And I'm here to talk to you about the difference between abstinence-only and comprehensive sex education. And I'm sure you're wondering why a high school student is talking to you about sex. Well, I'm the executive director and founder of Keystone Coalition for Advancing Sex Education. And for the last 2 years, I've been making it my mission to make sure we reform sexuality education into a comprehensive and inclusive model, one that empowers young people with knowledge. Because I've actually even written legislation to change it for the better in PA. Because right now, our country is going through what many are calling a public health crisis. Our youth are not getting the proper tools they need to navigate a sex-centric culture. And what do I mean by that? Sex is everywhere in a society. Turn on the radio, listen to music, watch the TV, and I guarantee you'll realize it. It's everywhere. It permeates every facet of our society. Yet in the classroom, what exactly are we doing to teach students to navigate this? And the truth is, we aren't. So, thanks to a ton of great scientific research from studies to surveys, the verdict is in on abstinence-only education. And it's a total failure. So let's look into the programs. Study after study after study confirm what many health professionals and educators already suspected, that abstinence-only education abstinence-only programs do not give students the skills they need to keep their bodies happy, safe, and healthy. In fact, it jeopardizes their health with a lack of accurate information. To put it simply, the absence of information is not education. Solely relying on telling somebody not to do something is unrealistic, and it's harmful to public health. And in the absence of this information, students are turning to what's readily available to them: the internet, sexually explicit material, and pornography. And that couldn't get further away from the reality of sex. It's a fantasy, not a reality. So let's look at the data. According to a federally funded study of abstinence programs, there is no connection between enrollment in an abstinence program to the delaying of sexual activity, having fewer sexual partners, or from students abstaining completely from sex. Another recent study from the Guttmacher Institute, which is a leading reproductive health research group, found that abstinence-only programs do not succeed in reducing rates of teen pregnancies or sexually transmitted infections. One of the co-authors of that study, her name is Laura Lindberg, she says, abstinence-only programs leaves our young people without the knowledge and information that they need. So, not only is abstinence-only programs harmful, not only are abstinence-only programs ineffective, they're actively harmful. A study from the Government Reform Committee, which looked into the 13 most commonly used curriculums in the nation, found only 2 of them were factually sound. The other 11 programs, used by 25 states and 69 separate organizations, were found to have subjective conclusions, unproven assertions, and outright falsehoods surrounding reproductive health. So knowing what we know now, that abstinence-only programs are both ineffective and actively harmful, it should shock you to know that the federal government has spent $2 billion over the past 20 years on these programs. In 2008 alone, we spent a whopping $176 million of taxpayer money on a broken system. So what's the answer? I just ripped apart one of the most notorious and popular sex education programs, and luckily I stand in front of you with a very clear answer. It's called comprehensive sex education. The idea that sex is taught in schools as a healthy and natural part of the human experience, but that students are given the proper tools to keep their bodies happy, safe, and healthy. Now, I didn't create sex education or comprehensive sex education. Countries in Europe, like the Netherlands, and here at home in California, have already implemented these programs to great success, and that's just to name a few. In fact, a global review of comprehensive sex education programs found that they have resulted, and this was from the United Nations, that they have resulted in delayed sexual initiation, fewer sexual partners, reduced frequency of sex, and an increased use of contraceptives. So that actually disproves a common myth about comprehensive sex education, that when we teach students about sex in a positive and healthy way, that they have more sex. And it's just not true. Instead, we give them the maturity and the information to understand when it's appropriate for them to engage in sexual activity and how to stay safe if they do. So, let's dig deeper into both of these programs, Abstinence-Only and Comprehensive Sex Ed, and we're going to compare them on 4 different important areas of focuses through 4 different lenses. First being sexually transmitted infections. Second being through teen pregnancy rates and unintended pregnancy. Third being through neglected student populations, namely the LGBTQ community. And fourth, through the lens of needing to address a sexual assault epidemic. So, on my first point, sexually transmitted infections are a serious public health concern, and we need to start implementing programs that are proven to reduce transmission rates. The CDC reports that 20 million new infections occur each year, 50% of them being ages 15 to 24. If that doesn't show you how we're failing students, I don't know what will. Other data shows us that 1 in 4 teens contract an STI each year. So not only, or apart from transmission rates, sexually transmitted infections are expensive. Give me some numbers here. What are you thinking that sexually transmitted infections cost Americans each year in healthcare expenses? Yell them out. 5 million. Well, actually, STIs cost Americans $16 billion in related healthcare costs each year. Let me put that insane amount of money in perspective for you. With $16 billion, we could fully fund Planned Parenthood for the next 12 years, continue to expand the growing network of community health centers all across the nation for low-income Americans. We could even provide free condoms to the entire United States population for decades. On to my second point, teen pregnancy rates. There is no conclusive scientific data that shows abstinence-only programs reduce teen pregnancy rates. In fact, it's quite the contrary. Students who are enrolled in comprehensive sex education programs have been found to be 50% less likely to experience an pregnancy than those who are in abstinence-only programs. On to my third point. There are a ton of students who are disproportionately affected by current standards, namely the LGBTQ+ community. According to a survey which was done by a coalition of human rights groups, which included the Human Rights Campaign, they found that less than 5% of LGBTQ+ students surveyed had experienced classes that included a positive view of LGBTQ+ topics. That lack of exposure breeds misinformation and misunderstanding in the classroom. And it creates discrimination, which manifests itself in discrimination and hate later on. Now, all students deserve comprehensive and inclusive sex education. And the LGBTQ community isn't even the only group of students disproportionately affected. Students with disabilities, both intellectual and physical, are rarely given the comprehensive, relevant, and inclusive information that they deserve. It is time that we start to recognize this discrimination that is going on in the classrooms with abstinence-only programs and start to empower people with knowledge through comprehensive sex education. On to my fourth point. It is up to each and every single one of us to act on the sexual assault epidemic. Every 98 seconds, an American is sexually assaulted. Let that sink in. One of the reasons why I got involved in reforming sexuality education was because my friends were sexually assaulted. And when they courageously told me their stories, I was heartbroken. I was shattered, to say the least. But I realized that in my own way, I could make a difference through activism. I channeled my anger about the situation into action, because advancing sex education in the classroom to talk about consent, to talk about respect, are all ways that we can create a society that is comfortable and safe for all of our people. Comprehensive and abstinence-only programs leave all of that out, all those discussions completely out of the classroom. Comprehensive sex education, on the other hand, has a real chance to make a change in our culture. And let me say this about our culture. I thank and applaud the courageous women and men who have been standing up loudly and clearly saying, "Time's up." We should not be living in a society that silences and ostracizes survivors, covers up their stories with defamation and delegitimization. All of us can do better to stand with survivors, hear, understand, and listen to their stories, and work to create a society where all people are comfortable and safe regardless of their gender and sexuality, to live without the fear of sexual violence and harassment. And that work starts in the classroom by talking about consent, talking about sexual assault, violence, and having those conversations early on. We now know abstinence-only education doesn't do that, and that comprehensive sex education has a real chance to make a difference. If you care about the health of our country, the health of our students, the inclusion of those on the outside, and the prevention of sexual assault, I implore you that if nothing else in this talk resonated with you, to let the hashtag #MeToo stories awaken your inner activist. Start working with organizations that are paving the way to make sure all of our people are heard, protected from violence, and in any case where an incident may occur, they are empowered with the knowledge about their community to seek out help. Abstinence-only education is just not cutting it out. And we know this now. We know it's ineffective, it's actively harmful, and it fails our students on all accounts. And that's why I created Keystone Coalition for Advancing Sex Education. Because comprehensive sex education is going to be a success for students, a success for public health, and a success for this country. So now I ask, what are you going to do? Thank you.